Hey everyone, it's Megan again, and this is my discussion post for this week. The first question we're supposed to answer is what assessment findings may indicate substance abuse related to opioid use. Signs and symptoms from emedicinehealth.com include someone who is pain-free, sedation, euphoria, respiratory depression, small pupils, bloodshot eyes, nausea, vomiting, itching skin, feeling flushed, constipated, slurred speech, confusion, and poor judgment. We understand that an excess of opioids would cause these symptoms, as we understand that the pathophysiology behind the way that opioids work includes presynaptic inhibition of production of neurotransmitter C fiber endings, postsynaptic suppression of evoked activity in nociceptive path, or remove the remaining parts of the regulation of inhibition of nociceptive impulses, and increased transmission of the descending inhibition of spinal nociceptive conduction. And that was the author of that's last name's Boy. What behaviors do patients demonstrate when abusing opioid medications? Use pathophysiologic concepts to explain why these findings occur. According to Medscape.com, patients that abuse opioids tend to take larger amounts over a longer period of time than intended. They experience persistent desire for opioids. They spend a great deal of time trying to obtain, use, or recover from the effects. They crave and desire opioids. They give up or reduce social and occupational activities. They develop a tolerance, and they continue to use opioids in situations that could be physically hazardous. According to drugabuse.gov, animal studies suggest the existence of at least one central reward reinforcement pathway for drug self-administration in the human brain. The opioid system appears to involve structures such as the periaqueductal gray area, the arcuate nucleus, the amygdala, and the locus coeruleus, which use peptides that mimic the action of the drug, such as heroin, morphine, and indirectly influence the sodium in a manner similar to stimulants. So we understand that patients that are going through withdrawal are going to do whatever they need to do to utilize the opioids to achieve that desired effect to reduce those withdrawal symptoms. In question 3, the best practice interventions that healthcare providers may implement to manage prescription drug use and/or addiction. This week we learned about the importance of screening, brief interventions, and referral to treatments. It's important for nurses to ensure that we're screening our patients for opioid abuse. According to samhsa.gov, screening quickly assesses the severity of substance abuse and identifies the appropriate level of treatment. Brief interventions focus on increasing insight and awareness regarding substance use and motivation towards behavioral changes. Referral to treatment provides those identified as needing more extensive treatment with access to specialty care. And that was the SBIRT that we studied this week. The last question is, in your clinical practice, how do you address possible substance abuse in your patients? What dilemmas have you encountered? And I work in a neuroscience unit, so we get a lot of patients who have chronic back pain and they've just come in for some kind of back surgery. And these patients are normally on large doses of opioids prior to their admission. And a large portion of them take their opioids as they're supposed to, as they're prescribed. And a select few will use some other form of medication to adjunct their pain management, kind of doing some self-medicating. And the way that changes our medication regimen for them is a lot of people who are harder to control their pain because of their tolerance, they either get ketamine drips or they'll get an epidural post-operatively to kind of help reduce some of that pain. And we'll have like our pain management team come and assess them, and they have their separate assessment that they'll use for patients with possible addiction or things like that. So something I found interesting here was, let me see if I can find it. An article that I found on chronic back pain and management with opioid treatment states comprehensive assessment and monitoring is recommended for all patients who are in long-term opioid therapy for chronic back pain. Close monitoring of patients who are at the greatest risk for misuse and their prescribed medication should contain a treatment protocol that includes an opioid agreement, regular urine tox screens, compliance checklists, pill counts, and if indicated, motivational counseling. Careful monitoring and the use of the abuse deterrent opioid will help hopefully decrease the abuse potential of prescribed opioids. However, risk of opioid misuse and addiction will remain, and close attention into screening and documentation of treatment outcomes will continue to be the gold standard of opioid therapy. And that was by Jameson. And I just thought that that was really interesting since that's something we all deal with on a regular basis. So that is my discussion post for this week. Thanks, guys.